There's some of the non-clusters. And decline in the number of deaths among confirmed cases and continuous decline in the number of hospitalizations and ICU admissions. As the ministry and counties undertake this robust evaluation of the Kenyan situation, let us maintain the containment measures. Our hands with soap and water, maintaining social and physical distance, wearing of face masks at all times in public places, and avoiding all forms of gathering, be they social or political. The government shall be advising the nation on the next steps as and when the situation so warrants. Fellow Kenyans, on our COVID-19 statistics, today 151 people have tested positive from a sample size of 2,552 tested in the last 24 hours. This now brings the number of confirmed positive cases to 35,356. Our number of cumulative tests stand at 479,697. From the cases, only two are foreigners, the rest are Kenyans. In terms of gender, for the first time, females have outnumbered males. We have 77 that are females and 74 that are males. The youngest is a 3-year-old child, the oldest is 74 years. By counties, the distribution is as follows. Kitui leads this over the last 24 hours with 54 cases, Nairobi with 23, Uasin Gishu with 11, Kiambu 9, Garissa 9, Migori 9, Kisii 7, Trans Nzoia 6, Narok 4, Kericho 3, Mombasa 2, Busia 2, Taita Taveta 2, Machakos 2, Kilifi 2, Laikipia, Bomet, Nakuru, Meru, Nyandarua, and Kajiado, 1 case each. In Kitui, the 54 cases come from the following sub-counties. 27 from Kitui Central, 8 each from Kitui Rural and Kitui West, 5 from Mwingi Central, 4 from Kitui East, 1 case each from Kitui South and Mwingi North. In Nairobi, the 23 cases are from Embakasi South 4, Westlands 3, Dagoretti North, Dagoretti South, Embakasi West, Makadara, and Ruaraka, 2 cases each, Embakasi East, Embakasi North, Kibra, Langata, Roysambu, and Starehe, 1 case each. In Uasin Gishu, the 11 cases are from Ainabkoi, 10, and Soi 1. While in Kiambu, the 9 cases are in Kiamba, Kiambu Town, Ruiru, and Thika, 2 cases each, and Lari 1. The rest of the breakdown will be in the brief. On a positive note, 173 patients have recovered from the disease, 107 of these from the home-based care program, and 66 have been discharged from various health facilities. Our total recoveries now stand at 21,483. Today, we have not registered any death from the disease. Our fatality, therefore, remains at 599. We want to thank our healthcare workers for the good work that they continue to deliver out there in saving the lives of our people. I thank you.
Nancy Okware kutoka KBC. Umezungumza kuhusiana na idadi ya maambukizi kuonekana kuondoka katika kaunti ya Nairobi na kuelekea katika kaunti nyingine, kama vile leo hii tumeona ya kwamba kaunti ya Kitui imeongoza kwa idadi ya maambukizi. Je, kama wizara ni kipi ambacho mnafanya ama kwa ushirikiano na zile kaunti ambazo pengine zinatarajia idadi ya maambukizi kuongezeka katika siku za usoni? Je, mnapanga kuongeza idadi ya watu ambao wanapimwa katika zile kaunti ama ni mikakati ipi zaidi ambayo mtaweka? Shukran.
Dorcas Wangera from Citizen TV. Yesterday you had intimated that you would make public the revised burial protocols after WHO also released the same. I don't know when this can be made public, because we have people who are asking. And then secondly, even at this time, the cold weather, are we seeing an increase in other infections, particularly TB, pneumonia, and influenza and the flu?
Beldin Oliaula from KTN. With the low records of deaths reported and also decline of positives, can you say the virus in Kenya has become less severe?
Please repeat that question again. I didn't hear it well.
I'm asking, with the low positive numbers, can you say the virus in Kenya has become less severe?
Less severe.
Helen Aura from NTV. With our research and the funds that have been put in terms of our research, how far are we as a country in our research for our vaccine?
Okay, thank you. Kitui, with rising numbers, and it's not only Kitui as we mentioned, we have said that the curve that we follow, the national numbers, is an aggregate of the entire country. And when you break that down now per counties, you will find that each county has a different history and different trajectory. But because the major areas where the largest numbers of cases have originated from, or the clusters, what we have even called high risk or hot zones, have been these counties of Nairobi, Mombasa, Kiambu, Kajiado, the general metropolitan area. We are seeing a smoothing a little bit of these major metropolitan areas, but now there seems to be rising numbers in some of these other counties. In due time, these counties will also be able to manage those numbers. Are we working with these counties? Of course, we work as a national government very closely with all the county governments to provide them with the necessary support to do the testing, the follow-ups, and to be able to gather these data that give us an indication of where we are in terms of the spread of the virus. So yes, we do work very closely with them. As soon as when we see numbers begin to rise in any particular area, that area draws particular attention again in terms of being able to enhance the level of monitoring through testing for those areas so that we can follow it very carefully. We can identify individuals who are confirmed cases. We can then be able to get them into care and isolation so that we are able to break that cycle of transmission. And we will continue to work with all the counties. We are watching very carefully most of the counties, those especially that seem to be showing from day to day increased numbers. Regarding the burial protocol that we talked about, this is something that is work in progress. I think Dr. Kuria had talked about it. Maybe he can respond to the timelines in terms of when this protocol will be made available to the public. Are we seeing any disease increase in other diseases because of this cold season? We have been monitoring that very carefully. We have been looking at trends of particularly diseases that we know flourish during the cold season, and these tend to be respiratory diseases. We have been looking at those trends right from the beginning of the year and comparing it with trends that we have observed in the past year. And the reason we look at that is just really to look at the impact of COVID-19 on that. That's another indicator that one can follow to see whether indeed you're having a larger number of COVID cases that might not be registered and you're missing them out. So there are a number of ways that we are looking at these numbers and to determine the impact of this COVID-19. What I can tell you is that the trends we see in terms of the other diseases is nothing unusual. They are more or less similar trends as previous years. But in fact, when we look at respiratory diseases in general, actually we have seen a lower trend this time of the year compared to the same time last year. So we don't have much worry in that area that COVID-19 is being masked as other diseases. All numbers low positive don't tell you that. What the low numbers just tell us is that the transmission is not has been interrupted, and it's not transmitting as fast or as widely as before. So those and that's what the containment measures are meant to do, is to break the cycle of transmission. So it tells us that we are not able to transmit, that the transmission of the virus has been curtailed to some extent, and that's why the numbers come down. To determine whether the virus that is circulating right now is different from a virus that was around a few weeks ago, that is requires a bit of research to look at the genetic makeup of the virus and see whether mutations have happened in some parts of the virus and whether that mutation is related to any clinical manifestation. So to put it simply, no, low numbers don't mean that the virus is less severe. Ellen from NTV, where are we on our research with particularly on the vaccine? You know that there are a number of vaccines that have been undergoing trial in the globe. Quite a number of them are being done in the USA. There are some that have reached stage phase 3, where they are now recruiting large numbers of patients to test the virus on. These phase 3 trials have mostly targeted they're recruiting from their countries, that is in the US, UK, and other places. They haven't extended that recruitment to Africa. But last night I was watching CNN, and I heard that the Moderna vaccine, which is in phase 3, that they are unable to recruit African Americans among the number of patients that they want. And that's an important observation, because in determining how effective a vaccine is, it needs to be tested in different geographic regions and in different ethnic groups, because sometimes those ethnic backgrounds can make a difference. So I'm seeing that possibly when these phase 3 trials might move into Africa and try to recruit subjects to be tested here in Africa, which would be a good thing for us. But we are still on track as far as the Oxford vaccine is concerned, which is the one that we are collaborating through the Kemri Wellcome Trust Research Institute with Oxford University in an early phase trial of that vaccine. That one is on track. The protocol has been approved, and recruitment is going to get started very soon. I hope that has answered your question, and thank you. Let me ask Dr. Kuria to comment just
Thank you, Councillor Rashid. I think we said this yesterday, that the protocols are developed and they are their final phases of review. At the having signed them off at the ministerial level. So if we don't attend by Friday, then maybe Monday, Tuesday, but hopefully by Friday we should be able to roll them out. Thank you.
Thank you, Dr. Kuria. I will ask Dr. Ombacho to say a word or two regarding the question on how are we supporting or working with some of these counties that now seem to be seeing increase in the numbers that of confirmed positives.
Thank you, Waziri. Just like we have informed you before, the ministry continues to support the counties based on a very clear criteria. And the criteria is, one, the disease burden, in this case, the numbers, the burden in numbers tested positive in those places. Building capacity. Building capacity is like having some infrastructure to support these issues. And also issues of technical, and also the geographical location of the county, noting that there are some counties which are very far. So what we have continued to do is that using those set criteria, we have come out with the percentage division of support in terms of material, in terms of the technical, the human, where we think that there is need for training, where we think that we need to send in our technical team to work with the counties. That will continue to, we have been doing it and will continue to do it. Now, in terms of the donations that we get, these donations go to all the counties based on those criteria. And indeed, there is those who actually request for quick support, and for those who maybe are not, it doesn't mean necessarily that if there is no disease burden, we don't look at each county. Based on the normal trends, we also address other counties in terms of support. Thank you, Wazir.
Okay. Thank you, Dr. Macho, and thank you. Have a good evening.